Good morning, everyone. Janelle Tennyson here with the Joint Replacement Academy and another coffee time video. I wanted to talk today about a question that I saw come through about how often blood transfusions are required after knee replacement surgery. So the short answer to the question is almost never. It is almost unheard of to require a blood transfusion, at least in the United States, after a total hip or knee replacement surgery. There's two main reasons that I wanted to visit with you about today. There are organizations that have traditionally taken the role of advising about many practices with blood transfusions. It's the Association of Blood Banks and the American Association of Hematology. So they used to recommend that blood transfusions were given when a patient's hemoglobin levels were 10 or below. In the last years, they have decreased that recommendation so that blood transfusions are not recommended until patients have a hemoglobin of 7 or 8, depending on factors and the specific type of surgery. So, of course, there are extenuating circumstances if a patient is actively showing signs of anemia that they would get a blood transfusion before that. Another reason why blood transfusions are almost unheard of after knee replacement surgery is because most organizations use a really wonderful medication called tranexamic acid. Tranexamic acid is given either in IV form or it can be given topically right into the surgical field. This medication is safe for almost everybody, like almost everybody, whether it's in IV form or for certain factors it can be given topically. It works with the body's natural clotting process that it has in place to help minimize blood loss after injuries. A question that a lot of people have is whether or not using tranexamic acid then puts you at risk for the developing of a dangerous blood clot in the recovery period. And the answer is because of how that medication works in the clotting process. No, it really doesn't put you at risk for that. It would be a really interesting question for you to ask your surgeon whether or not they use tranexamic acid and why not. It's really been a game changer in reducing the need for blood transfusions. There are other factors that can decrease blood loss and the need for blood transfusions, but those are the two main reasons I wanted to talk about today. So have a good day, everyone, and we'll see you again soon for another coffee time video.